I'm going to have a conversation with Rosa DeLauro. All my friends who have dense breasts or who know women with dense breasts, I hope you'll join me to talk with Rosa DeLauro about the Find It Early Act. So the Find It Early Act was introduced by Rosa and Congressman Fitzpatrick, basically to ensure that insurance companies pay for additional screening for women with dense breasts. Someone asked about the border. That's a good idea. I think we should do an Instagram live about what's happening on the border. So thank you for that. Um, anyway, she's going to tell us a little bit about the Find It Early Act. There you are, Rosa.
Here
Hi.
I am. Good morning. Good morning.
I know you've been running around like a lunatic on Capitol Hill, so thanks for taking the time.
Thank you.
Happy Mother's Day to everyone out there. And basically, Rosa, we just wanted to hop on this Instagram Live. The response I got to encouraging people to make comments on the U.S. Preventive Services Task Force website was really overwhelming. So many people are commenting. And by the way, you can comment until June 5th, everyone. And so I'm so happy that you are really getting involved in this issue, Rosa. And I thought you could just explain to everybody what the Find It Early Act that you introduced several months ago and reintroduced after the USPSTF said that there was not sufficient evidence to recommend women get additional screening other than a mammogram for women with dense breasts. So can you just explain the act and what it will do?
Sure, I can. And first of all, thank you very, very much. And it's wonderful to partner with you on this. And as you pointed out, the partner with my Republican colleague, Brian Fitzpatrick, on the legislation as well. But that is it. The issue is, in a nutshell, there is sufficient evidence to make the case that once women have been notified that they have dense breasts, and that they work with their provider and they need additional screening. And in order to be able to afford additional screening, they need to have insurance coverage. And when the Preventive Services Task Force only gave this an unacceptable diagnosis, if you will, they give it a grade C. Insurance companies, it's inadequate, an inadequate designation that the insurance companies don't recognize that. So the legislation that we are looking at is it mandates that all the insurance companies would have to cover diagnostic mammograms, breast ultrasounds, the MRAs, the kind of screening that is needed. Once you know you have a dense breast, then you move toward additional screening. And these are the two methodologies that are the most accurate for determining whether
breast ultrasounds and MRI. But as you point out, a lot of insurance companies don't cover them. And so only women who can pay for these services out of pocket can afford to get them. And that's just absolutely wrong. You know, Black women have a 40% higher mortality rate from breast cancer, as you know. Everyone should have these life-saving technologies available to them. But, you know, it's interesting because there has been some movement, Rosa. You and I have been working on this issue. The FDA has mandated that states are required to inform women with specific language that they have dense breasts. Before, it was a very kind of patchwork regulation, wasn't it? And it wasn't clear at all in terms of A, if women had dense breasts, and B, what that means and what they might want to do about it, right?
Right. This is an issue. You very specifically, Katie, what you've identified. This is notification and then coverage. I've been working on the notification side of this, I believe, since back to 2011. Finally, the FDA has issued the rule that, you know, by September of 2024, all providers have got to provide the information to a woman that whether her breasts are dense or not. And then that means if they are, and the language is very clear, then they need to move to be able to have additional screenings, that ultrasound or that MRI. Now, the notification is going to be there, but now, unless you can afford it, there's thousands of dollars to deal with this without the insurance coverage. At its very basics, as you know, Katie, this is about saving lives. So that this delay or whatever the heck this is, this bureaucracy, is really putting women's lives at risk.
I got a lot of comments, Rosa, when I posted about this. So many women saying that their breast cancer wasn't diagnosed with a mammogram, that they had to wait for additional testing like an ultrasound or an MRI.
Right.
But the USPSTF claims that there's not enough research or medical evidence that this will serve women, the 45% of women 40 and over who have dense breasts. So my question is, why hasn't there been more medical research? And is this another case of women being marginalized by the medical establishment?
Well, there's two parts to this, Katie. First of all, there is substantial medical evidence. Actually, since the task force came out with this inadequate designation, I've been trying to talk to medical professionals, all of whom have said to me, it's very clear. So do we need more research? Absolutely. But there is enough research now on which to make a designation of a B grade. I feel like it's a report card, but with a C grade, the insurance companies are not going to pay attention to it. They are not going to do what they need to do. And research is there, the data is there, the science is there, and there isn't. From my view, I've just said, I just think in terms of marginalizing women, I think that the task force is marginalized women and not and putting them at greater risk. They said we need more studies. And when I have talked to medical professionals, they just said to me, Rosa, that's not going to happen. They're not going to be putting in all of this, additional funding to be able to do this. Now, we can make a case for doing that. In the meantime, what's out there is more than adequate to make a designation.
I wonder, will you ask King and Caitlin on your staff to send me some of those studies?
Yes.
Because I would like to look at them and share them with my followers so that they know the medical evidence is out there. Well, one of the reasons you reintroduced the Find It Early Act is with these sort of lack of recommendations. That's when insurance companies will cover these things, as you pointed out. So you figured we've got to do it another way. So the question is, do you have anyone? By the way, I talked to Amy Klobuchar because I interviewed her the other day, and I said, please call Rosa's office so you can be a sponsor in the Senate for this legislation. And I guess the question is, does this legislation, it does seem bipartisan, women, Republican and Democratic women have dense breasts and their lives could be saved by these screening methods. So, does it have a chance to pass? And how can women who care about this issue, help make their voices heard? Because I imagine the insurance companies may fight this tooth and nail, no?
The insurance companies will fight it tooth and nail, especially because there is an inadequate designation from the task force. But I thank you because Senator Klobuchar, I'm so delighted to partner with her in this effort.
She had breast cancer during the pandemic. She was diagnosed with early breast cancer as well, like I was.
Yeah. So we good. I believe that this is a piece of legislation that can garner bipartisan support in both bodies, in the House and in the Senate, and it should. And that's what we're going to do, is to try to push to get the co-sponsorships so that we can get to the numbers that we need to see if we can bring a bill to the floor of the House and Senate to pass. In the meantime, your point, and to your followers, you have representatives. There are representatives all over this country, senators all over this country. You ought to be focused on them, talking to them, go to their district office, get together with your friends, do a phone calling, letters, do press on this, write an op-ed. It is imperative that there be really a very groundswell of women's voices, men's voices as well, saying this is unconscionable. We know it. We've got evidence. Let us make sure that when women are notified, that then they have a course of action, and it's not going to be unaffordable, and their lives can be saved. And I don't know anything stronger than that. I just don't.
That was incredible, and I think it's just so wrong that to have almost a caste system of healthcare where women who can afford it, their lives can be saved. Women who can't are stuck, and unfortunately are often diagnosed with breast cancer later when it's less treatable and sadly less curable.
And I know you've gotten out to, to your followers, all of the data that talks about, 40% of the women in this country with dense breasts, what the survival, early detection is survival.
It's so true.
I was by accident diagnosed with ovarian cancer in its earliest stages. That allowed me to be able to survive. And that's why when we have information, again, we can move. We do not have to wait. I did ask the task force, how long? And I will commend them of moving the screening for mammograms from 50 to 40. I applaud that. But that took years to do.
Also, by the way, they're still saying every other year.
Yes,
and
it's
most breast radiologists and gynecologists and cancer experts say it really needs to be every year.
Every year. And then you got the issue of women under 40, but we won't go there, and especially with Black women. But in the meantime, that's what really makes me angry, that we have a way to look at this, and we're going to delay, and that delay means lost lives. That's unconscionable.
Real quickly, would Medicare also cover this? Someone is asking.
Yes.
And this is without any out-of-pocket costs by the patient.
No co-pays. That's right. And that's why that designation is so important.
Someone asked if you've gotten much support for this so far. Have you heard from many of your fellow congresspeople?
We're hearing, it's early. I think we just introduced it a week ago. But I've gone to the floor of the House with cards and given that out, so we'll get people on. But I think we will have, and again, because as you stated, it is bipartisan, and I think, what is going to get members to sign on? They need to hear from their own constituents. The folks in Montana need to hear from their people in Pennsylvania, wherever, Texas. You be in touch with your member of Congress to say, please support thus and so. Do it in volume. Get 15 of your friends, so forth, all with the same message.
I also think that, people think that it doesn't, it doesn't matter if you call your senator or congressperson, but it actually does.
It matters.
They pay attention. If they're hearing from their constituents, they pay attention. And so you might think, oh, it's just one person, but as Rosa said, get your friends, get everyone to call.
If people come to my district office, 10, 15 people, the district director would pick up the phone. She said, Rosa, we have 20 people here. They're all talking about this. You pay attention, because if you don't, you do it at your peril.
Right, exactly. And I think that maybe we should get some women whose lives were saved through ultrasound and MRI.
Excellent.
And give testimonies. Are you going to have hearings about this, Rosa?
Well, the issue is, since we're no longer in the majority as a Democrat, I can't call a hearing. We can certainly work to do a briefing, which I'm happy to try to do and do that. But a formal hearing, I cannot call any longer because I'm in the minority. But I will.
Can we get a Republican co-sponsor in
I don't
the
know.
Senate?
I don't know if Brian would be willing to try to do something here. But we can explore that. Happy to explore.
And
it.
also maybe just even having a press conference
Yes.
with testimonials, maybe
that's right. That we can do. That we can do. We can also, as I say, we can do a briefing and make that bipartisan as well. Because I think you said it best. These Democratic, Republican women, these are their breasts, and density doesn't select who by, political party.
Absolutely. Well, thank you for being a real leader in this and so many other issues, Rosa. I really, really appreciate it. And somebody, while I have you, any thoughts on what's happening down at the border? I think this is going to be a big crisis that both sides are going to have to get together and figure out what to do about it. Are they talking about this on Capitol Hill today?
It's being discussed, but the last point that you made is the critical piece, that both parties need to be speaking about it. The issue of overall of immigration should not be used as a political issue to create division in the country. That should not be the purpose. We have always been a country that has welcomed immigrants in a legal way. My dad came in 1913. My grandparents, I'm first generation. However, you have to have both parties with legislation. And I will say this, I know it sounds political, but legislation was offered in a bipartisan way from the Senate several years ago.
That was with John McCain and Teddy Kennedy, right?
Yes. I want to talk about two people of opposite views, etc. They understood the nature of the problem. They came together, said this is a roadmap. In the House, unfortunately, it was by Republican colleagues just refused. So I say this should not be a political issue. It is a humanitarian issue. It is one in which we should make provisions to provide for legal immigration into the United States of America. That is what the goal should be. But you need two parties focused on that to be able to get it done.
Do you think comprehensive immigration reform is a possibility, or has it become too weaponized?
Well, it's been weaponized at the moment. As frankly as I can put it, that you need to have a change in some of the folks who are here, who are willing to look at immigration. One, understand that immigration is not a bad thing, but how do we do it? How do we do it legally? And how do we deal with the humanitarian side of this effort? And we also recognize that we do have an asylum a process, and to follow the process. But again, if all you want to do is to stand up and say there is an invasion of people and create division and create distrust, and that is not going to answer the question. It's what are the solutions? How do we do it? How do we make this legal? How do we say to people, I'm sorry, you can't be here, you go back? And quite honestly, with asylum seekers, most of them are really sent back to, where they are. But you got to have two parties that want to solve the problem, not to use it as a political wedge. And I'll be frank, my Republican colleagues, they view this as an electoral issue that they gain if it becomes one of just weaponization, political weaponization. Can't do it. I've been to the border many times, and my committee deals with unaccompanied children and what happens with unaccompanied children. And by law, we have to deal, unless you want to change the law, but there is a law in the books now that says unaccompanied children have to be housed until we can vet them and a sponsor and make sure that they have a safe placement. The other piece of this is we cannot leave behind any of our international obligations in looking at several of the countries where people are coming from,
Right.
and how are we working with them? What are we doing with economic development that says to people, I'm not going to risk my life, but I'm not going to risk my children's lives to make these dangerous crossings.
It's a very long-term, complicated issue, and it really does require a lot of a bipartisan solution.
Right.
And I hope at some point that happens, because if not, it's never going to be solved and will cause a lot of chaos to these border towns. I sympathize with the people who live in some of these border towns. I think they don't get enough attention sometimes. And but also, you know, there's got to be a more humanitarian way of helping people who do want to come into this country.
The United States. As I said, my dad came.
But obviously it's so broken now, though. It's clearly broken.
It is very broken. And what we can't do, what we cannot do, is to do what was done a few years ago, and that is to separate children from their families at the border. I will just tell you what, you know, when you bring your clothes to the cleaners, Katie, they give you a ticket so that you can go back and get it. When you put your luggage in at the airport, you've got a tag, you retrieve your luggage. What effectively happened under the prior administration and the separation of children from their families, and I was intimately involved in this, they had no way of identifying the parents and the child. There are still children today who have not been reunited with their families. You just can't imagine a child with a loss of a parent with not knowing where their child is or ever reunited. That's not a humanitarian policy.
Rosa, thank you so much for talking with us. Thank you for answering my questions about what's going on at the border. And again, thank you for your leadership on behalf of all women who we want to live long, healthy, happy lives, and who deserve to do just that, no matter what their economic situation is.
Thank you for taking this on, and for so many other things. You really are a beacon for all of us.
Well, I'm trying, Rosa.
And you're succeeding.
Have a great weekend.
You too.
Thanks, everybody.
Have a lovely weekend.
Okay,
Ciao.
bye.